Hi, I'm Natalie Henning, the host of the show Ins and Outs of Medical Imaging. This is a production of Creative Communications at Jordan High School in Jordan, Minnesota. In this episode, I'll be breaking down ultrasound. I'll be breaking down the background, who invented it, when it was invented, what scans look like, when they're used, where they are used out of the medical field, what to expect when getting an ultrasound, also how ultrasounds will look like in the future, and how they impact the medical field. Let's begin with the background. Throughout my research, I have learned that ultrasounds have been invented through many years. In 1794, we found out that bats use sound waves to navigate where they're going. From then on, in 1928, there was a proposal of an ultrasound to find the flaws in metals. Also, in 1928, Jacques and Pierre Curie noticed that applying electrical currents to crystal quartz produced a sound like ultrasonic waves. In the 1950s, John Makar and Tom Brown developed the first commercial ultrasound. Let's get into how ultrasounds work and how the images are made. According to the Food and Drug Administration, ultrasounds use a high-frequency sound wave to view the inside of the body. There is a transducer on the machine that sends these waves through the body. The waves are then reflected off the tissue and organs back to the transducer, causing the images to be seen. Now that we know that, let's get into what the scans actually look like. The images are made from different shades of gray. They represent the density of the tissue. Usually fluid buildup like cysts are seen as black. White represents dense structures like bones, so the lighter the shade of the gray, the denser the tissue is. You might know some of the reasons why ultrasound is used, but let's break some more reasons down. Ultrasound is used as a guide for biopsy and tumor treatment. It also helps doctors evaluate blood flow, thyroid glands, gallbladder disease, uterus and ovaries during pregnancy, and monitor the baby's health. I'm going to begin with a Doppler ultrasound. This is used to measure the blood flow through your veins. This happens when the ultrasound waves bounce off the red blood cells. This kind of ultrasound is used to detect blood clots, poor functioning valves, heart defects and blocked arteries, decreased blood circulation, bulging arteries, and closing of arteries. Another type of ultrasound is abdominal ultrasound. This is used to see inside the belly area. It's done to see blood vessels, the gallbladder, intestines, kidney, liver, pancreas, and the spleen. Now let's get into obstetric ultrasound. This is used to create images of developing fetus or embryos and the mother's uterus and ovaries. It's used to tell if you're pregnant or pregnant with more than one baby, fetal health to the baby and mom, the age of the pregnancy, the fetal position, the baby's amniotic fluid, the placenta, the chromosomal issues, if there is any, and the gender of the baby. Also, there's transrectal ultrasound. This is used to get images of the prostate or surrounding tissues. It's used to detect prostate conditions, enlarged prostate, rectal conditions, and reproduction or infertility conditions. Thyroid ultrasounds. These ultrasounds of the thyroid are used to determine different conditions like cysts, cancer, and autoimmune disease called Graves' disease. It's caused when the thyroid produces too many hormones. Calcification is a buildup of calcium in different minerals, and goiters, which is swelling in the neck, causing the neck to be enlarged. Retinal ultrasound. This is used to image the kidneys, the bladder, the uterus, and determine conditions like Kidney stones or the kidney transplant, cysts, tumors, abscesses, fluid conditions, blood flow, or damage from an injury. Endoscopic ultrasound. This is used to examine the upper and lower gastrointestinal tract. It can help diagnose cancer, the pancreas, the bile duct, which is a small tube that carries the bile to the intestines, the gallbladder, and cysts and tumors. 3D ultrasounds. These are most commonly used for fetal imaging, but they're also used for internal imaging of the intestines, evaluating facial abnormalities, and imaging of the prostate. Doctors can also use ultrasound for guided biopsy. Most likely, this kind of ultrasound is used when the breast shows an abnormality like a solid mass, distortion of structure to the breast tissue, and abnormality of tissue change. Let's talk about ultrasound outside of medicine. It's used in industrial processes by cleaning, welding, cutting, forming, testing metals, and more. Distance measurement by seeing how long it takes to return to the sensor. Environmental monitoring like water by measuring the size of the particles in the water like algae, bacteria, and sediment. Art conservation is used to access paintings, sculptures, and artifacts. Ultrasound is used to reveal hidden layers, repairs, or damage that's not visible to the naked eye. Ultrasound can also be done with contrast. When getting an ultrasound done with contrast, it makes the blood flow and organs appear more visibly. Most likely, contrast in this form is used to examine the liver, the spleen, the kidneys, the pancreas, the bladder, and the bowel movements. Contrast agent will get injected into your IV system or into your body, just like CT and X-rays. Now let's understand how ultrasound has impacted the medical field. Being able to have a non-invasive, real-time images of the body is a big deal. This allows for early detection of disease, meaning it has a higher chance of being cured and before it becomes even more of an issue. It also allows for precise guidance for surgery and biopsies and even procedures. It has a huge part in fetal monitoring during pregnancy, all while still being safe and accessible for most people. Just like every other medical imaging machine, they have evolved over time. But let's understand how ultrasound will look in the future. 3D and 4D ultrasounds will become more detailed. They also become more accessible by becoming handheld. They'll also become wearable. Also, personalized image designed for specific applications will be used. This information is from castling.com. Here I have Isabel from another show of our class, Creative Communications. She's from the show
Legends Unleashed.
I'm going to be asking her a few questions about her ultrasound experience. So Isabel, when was your first ultrasound?
Probably when I was like 12.
Okay, what was it for?
They were trying to find out if I had a kidney infection.
And were they able to diagnose anything from your ultrasound?
Yes, they told me that I did have a kidney infection and it came from having a UTI before.
Thanks for joining.
Of course.
Here I have Miss Peters. Miss Peters, have you ever had an ultrasound done?
I have actually.
What was it for?
Well, I was pregnant 3 times.
Did you figure out the gender of your babies?
For the first 2 we did. For the last one we decided to be surprised.
Thank you. Here I have Miss Brenda. So I'm going to ask you a few questions about ultrasound. I'm going to begin with, have you ever had an ultrasound done?
Yes.
And then what was it for?
I had them for when I was pregnant with my kids and for gallbladder surgery.
Were they able to diagnose anything from your ultrasounds?
Yes.
Super. Have you ever had an ultrasound done?
I have.
What was it for?
It was for determining how pregnant I was.
Were they able to diagnose anything other than you were pregnant?
No.
Did you figure out the gender of your baby?
No. I wanted it to be kept secret. And little did I know how good the ultrasound techs are, and they could tell already. That was back in the day.
Thank you. Here I have Alana. Alana, have you ever had an ultrasound done?
I have.
What was it for?
In 2014, I was diagnosed with thyroid cancer, and they used the ultrasound machine to check my neck and to see how big my tumor was.
Thank you.
You're welcome.
Here I have Mr. Chris. Mr. Chris, have you ever had an ultrasound done?
I've had several ultrasounds done.
Can you name what one of them was for?
I've had ultrasounds done on both of my knees, and they found torn meniscus for both of them.
Thank you.
Okay.
Here I have Mr. Olson. Have you ever had an ultrasound done?
I have.
What was it for?
I had a little abdominal pain.
And were they able to diagnose anything from your ultrasound?
Fortunately, they didn't find anything wrong with me, so I guess they did not diagnose, but they came to a conclusion. So, and that was good news, right? No news is good news.
Make sure to follow along if you're interested in the medical field or have ever thought about having a career in the medical field. Have you ever had an ultrasound done? Comment below what kind of ultrasound you had done and what it detected. Please follow along and share so you can keep up with learning about different types of medical imaging. Thanks for watching.